do an incision like that. And then you see how there is this vein, which is the interfascial vein, in which if you don't injure such a vein, you're likely not in the interfascial plane. So remember that, again, frontotemporal branch of the facial nerve is going to run in this tissue here at some point in the 3 centimeters proximal to the orbital ring. We're going to do that. And here we see under magnification, we have the fat. The nerve doesn't travel here. So one of my friends correct me in one of the dissection prior. So I appreciate the input. And here we are incising the fat. And you see this vein. This is the interfascial vein. So once we are at this level, on a in vivo, we want to do this movement in which you separate the fat. You're always going to injure this vein. Like I said, if you don't injure, you're not in the space. You can coagulate some pressure and not always stop. But here is a good way to dissect and find the deep fascia, which is right here. Superficial fascia is right. We already incised it and we incorporate to the flap. You realize here it was already incorporated to the flap before. And here we're just separating this layer. We discount this vein here, in which we need to do hemostasis. Always try to avoid hemostasis here. Sometimes just with some pressure with your axon is enough to stop the bleeding from this area, and then you can coagulate in the area proximal here. So I'm just going to cut it for better illustration. This is a thick interfascial vein, so this is just for educational purposes. And tell you that we did another dissection on the other side, and it wasn't as thick in the other side. So that speaks about how I always hear from my anatomy professor that how asymmetric we are.